everybody. First off, thank you to Maggie and HealthTO for having me tonight. Just as a little bit of background about myself, I'm Jeremy Weisz. I'm a co-founder of a company called Greenspace Mental Health. And what we do is we're focused on helping patients improve mental health outcomes. And we do that in two ways. First off, we help patients and their therapists tangibly track progress through treatment. And second, we draw on that network of providers to help family doctors match their patients with a mental health therapist they're likely to be successful with, and then foster that collaboration and communication through the treatment process. But we're not here today to talk about Greenspace. And you can see from the title of the presentation, what I'd really like to get into is why I think we need more people who don't have a background in healthcare to start healthcare companies. Maggie gave it away. I don't have a background in healthcare. Why else would I be talking about this? I have a background in business and law, and after being a lawyer, I went and helped start a stock exchange. Nothing to do with what I'm doing right now. And this is none of which is to say doctors, healthcare professionals, researchers shouldn't start healthcare companies. But if you come from a business background, if you come from another type of background, and you have an idea and you think there's a way to make it better, don't shy away from it, because you bring a lot of skills that others just might not. So first off, the first reason why I think it's important is there's some really big problems. Obviously, we focus on mental health. So one of the stats we share often is that 500,000 Canadians miss work every week because of mental health issues. These are people who have jobs, but just don't go to work because they can't. Canada's not a very big country. There's 17 million people in the workforce. So 500,000 people who are actually employed not going to work, that's a huge number. And we could come up with statistics like that in every industry. There's 370 million adults affected by diabetes worldwide. Every 70 seconds, someone in the US develops Alzheimer's disease. So this is big. These are real problems. They're important problems. And quite honestly, if we only have healthcare professionals and researchers working on these, as a society, we don't have the bandwidth to deal with it. We need our best and our brightest people taking a shot. And so to that end, I want to highlight a company that came out this week. It's not our company, who identified a really, really important problem, and they said, we're going to go find a solution. So this company is called Here Comes the Airplane. They realized that food companies, delivery companies, they bring the food to your door. But then how are you supposed to get it from your door to your mouth? Who solves that? So these guys, they will literally help you take the food from the package and put it in your mouth. And for those of you who haven't realized it, this is a joke. This is not a real company. But there's silence out here because this could actually be a real company. People start dumb companies all the time and get money for it. But if we're thinking this from a society perspective, why would we have our best and brightest people build companies like Here Comes the Airplane? We don't need any more food delivery companies. We don't need any more social media dashboards. We need people solving actual problems. And we need our best and brightest people. The second one is, I wrote on the screen, but not being positive the right answer is actually a really good thing. And it makes you listen. And there's a big difference between a lot of startups that say, we love to listen to our customers. We listen to feedback. That's how we grow. And there's a difference between having to listen to your customers. By not being a psychologist, by not having a background in therapy, I don't come with any preconceived biases about how it should work. I don't take a couple situations that were particularly good or particularly bad and say, okay, I need to build a service or a product for that. And so an example that we like to share is we actually didn't start as a company focused on progress tracking and facilitating care between doctors and therapists and their patients. We started as a telehealth platform. That was the initial idea. And we went and talked to therapists, and the feedback was, well, the telehealth part is interesting, but tell us more about this progress tracking tool on the side. And had I been a psychologist and had it been an actual experience having difficulty connecting to a patient remotely, maybe we wouldn't have been so easy to say, forget telehealth, let's focus on progress tracking. But because we didn't have that preconceived bias, we actually listened to what people said and we built what they wanted. And then the third is, kind of an obvious one, but you get to think outside of the box. If I think back to being a lawyer, I went to school for God knows how long to do it, and then I articled, and then I worked in a law firm for a while, and you get caught up in the way things are done. It's quite easy to identify problems and think of solutions, but it's very hard to take a step back and think of actual really big picture solutions because you're so close to it. And so one example I'll use to highlight that This is a dashboard that we offer clinics, organizations, and hospitals to show them in real time how their patients are improving across the whole organization, and you can filter by area. And the premise of this actually came from the concept of supervision in psychotherapy. The idea that many therapists, whether different types of therapists or training therapists, need to be supervised by somebody senior to them. So I'm not saying this is the solution somebody would have come up with, but as a supervising therapist, you might have said, Greenspace's tool does a great job automating progress tracking, helps us improve outcomes. But it's still a little awkward in the supervising process. I have to ask them to print off the results, and they share it to me. The solution might have been, let's have a button that automatically puts it, prints off the results and sends it to my supervising psychologist assistant. That would be a good solution. It would be helpful. It would make things work faster. But you might have missed a bigger picture where we could say, what if we take a step back, forget the one-on-one relationship, but big picture across the organization, filtering any way we want, we should be able to see how people dealing with mental health are actually doing, and not just guess or not just deal with it on a one-on-one basis. And so that's, it's an opportunity for people who can look at it more broadly, who aren't, who don't have 3 years of law school in the back of their mind telling them they must do it some specific way. It lets you actually do things that are innovative, that are not just, a small evolution, as David talked about, not just selling benefits in a different way, but doing something totally different. So that's what I wanted to cover today. I'm really glad there were a lot of miscellaneous in the crowd earlier. If some of you are thinking of starting a health company, you're getting involved in health innovation in some way, but you're not sure because you're not a researcher, you're not a doctor, don't be shy. You have a lot to offer, and you can do it. Thanks.
Any questions?
Hi, thanks for that. That was pretty good. So my name is Zoo. I just have a quick question regarding basically this platform for self-assessment. I actually also ran a mental health organization, so I have a bit of background with this. And I was wondering how you would get out of some patients to self-report accurately, especially when it's dealing with mental health. So people who might have some sort of psychosis won't be exactly able to accurately reflect how they're feeling or how they're progressing. So I was wondering how what level of legitimacy you give to these kind of assessment scores.
So the assessments, first off, they're a component in a therapist treatment. So we're not a self-help app by any stretch. We do help new patients find therapists, but we're not a self-help app. And so it's a piece in the treatment plan. But as you point out, the assessments that we use, while they are all evidence-based and they are all designed as self-report measures, they're not necessarily appropriate for every single type of client or type of patient. So those dealing with more severe psychosis or bipolar disorder, the measures aren't necessarily appropriate for them. And so we recognize that. But from our perspective, 80% of people dealing with mental health issues is depression and anxiety, which this is appropriate for. More specifically, we can talk about this afterwards, but therapists have the ability to administer assessments only in their office with their client or their patient with them. So something like that might be more appropriate with somebody dealing with psychosis, where you can walk them through the assessment and help them understand what they're doing.
Yeah, quick question, and great talk, very cool. You started off with, we need people who are not in healthcare to make healthcare better. Great question. Took a photo of that, and that's very cool. Could I ask, do you think we could flip that around the other way? Would it be fair to say we need people who are not in tech to make tech better? And the only reason I ask, I don't mean that's not inflammatory in any way, but a lot of healthcare, a lot of clinicians are quite afraid of technology. And you see, there's got to be some way that we can better integrate those two worlds. Would that be fair to say?
I 100% agree with that. I think first off, there's a good trend in terms of tech companies moving away from Silicon Valley and investors being interested in companies that aren't necessarily from there because it's just a bunch of tech people. And I'll pitch, there's a representative here from the biomedical zone where we work from every day. They do a really good job bringing healthcare professionals in who have ideas but don't necessarily know how to execute or what the next step is to do it. I think more things like that are really positive because at the end of the day, I might have ideas, but people who are on the front line, they see the real problems every single day, and to the extent we can match more people who are healthcare professionals who may be a little nervous of getting into tech with people who are comfortable with tech, that's a really great thing.
Okay, we're going to take one quick question.
Hi, thank you. Very interesting, powerful. I was involved with a company that created an e-counseling for people with mental health. And one of the drawbacks of it was a particular app that they have developed, and so people with different ages, particularly they have teenagers with depression, psychosis. And one of the challenges they had was really around confidentiality and around privacy, because that's a very big piece with the mental health. And in fact, that's a challenge in the electronic charting. We don't use in medicine and medical nursing electronic charting with PNH, for example. How did you have those challenges? How did you overcome? So was that part of your piece?
Absolutely. You can't offer a service or a product like this unless you're compliant. Not only compliant with the privacy legislation, but you need to properly safeguard the information. Otherwise, you're doing a disservice to everybody using the platform. And so the approach we took, which most good healthcare companies take, is before you start building the platform, you have an understanding of what safeguards you're going to build in place, what's important, both generally and for your application, and you build according to those standards. And so we did that. One of the benefits of having been a lawyer is legislation is not scary. So while we do use experts and consult with people who are experts in the field, I felt like we started from a better position of understanding because we were able to understand the legislation and what was required. But if you are thinking of starting an app, there's a lot of really good resources out there. Patrick, who's in the second row, offers consulting services for companies, specifically around privacy and safeguarding information. And it's really important because what we don't want is people just saying, I can do it myself, I'll figure it out. That's not good for the healthcare providers using it or their patients.
Thanks so much, Jeremy. So